For the first time since the start of the outbreak, there are signs the spread of Ebola in West Africa is slowing. That was the message from President Obama today, who stressed the importance of remaining vigilant until the disease is wiped out. He also said the United States must be a leader in that fight.
America, in the end, is not defined by fear. That's not who we are. America is defined by possibility, and when we see a problem and we see a challenge, then we fix it. We don't just react based on our fears. We react based on facts and judgment and making smart decisions.
The president's remarks come as policies for containing Ebola here in the United States come under fire. The New England Journal of Medicine, which is not prone to rocking the boat, made waves this week by publishing an editorial equating mandatory quarantines for healthcare workers back from West Africa to driving a carpet tack with a sledgehammer. It gets the job done, but overall is more destructive than beneficial. Here to elaborate on that position is Dr. Jeffrey Drazen. He's the editor-in-chief of the New England Medical Journal. Welcome to Greater Boston. That was a great line.
Well, it explains what I think has happened. For this epidemic to be controlled, we need to control it at its source in West Africa. As we watched, it went from 100 to 1,000 to 10,000 cases, and we now see some progress. What the president was mentioning was the World Health Organization had estimated at this time that there would be between 15 and 16,000 cases, and there are only about 11,000. So we're below projections, suggesting that what we're doing to mitigate this is working, which means we need to have people on the ground. If we don't do that successfully, in 6 months' time, there could be 100,000, and some projections suggest even more. And then no matter what you try to do to contain it, you won't be able to contain it.
You have the most convincing description of how you catch this and how you can't catch it that I have read to date, because everybody's skeptical. Everybody. You say, for instance, that if somebody has a fever, it doesn't mean they're contagious. Now, you convinced me, but convince everybody else.
So the way we understand this, and it's an evolving picture. So we would love to have perfect information. We're not going to have perfect information when we need it. So we have to use the facts that are at our disposal. What we see is the family of Eric Duncan, the Texas man who died from Ebola coming from Liberia, they didn't get sick. They were with him. They were very close to him. It was the nurses who cared for him at the end of his life. And at that time, we know the viral loads on the skin and the blood are very high. When we look at other cases, this is what we see. It was the same in Spain, where the Spanish father who died, the nurse that contracted Ebola was the one who was changing his diaper at the end of his life. So there's reason to believe, and pretty good reason to believe, that at the beginning, you're not that infectious. And the two reasons to believe are the epidemiology that I've just spoken about, which is anecdotal, but it's the best we have. And the second is that if we do a very sensitive blood test, at the time the fever starts, we can't recover the virus from it. And interestingly, at the end of this illness, when you look at the German patient that we just reported on, his viral loads in his plasma went down in 2 weeks without any treatment other than his own immune system. And then what happened was that it persisted in his sweat. You could pick it up. Okay. But he wasn't infectious.
That's the part that I want to focus on, though, because you call me virions or viral loads. Yeah. This is the whatever it is that actually carries the virus with it that makes it contagious. Is it any kind of bodily fluid, from sweat to vomit to, we don't have to go through every single one, but you catch my drift. Can you get it through the skin? Does it have to be somehow contact through your eye? Does it have to go into your system? How do you get infected?
So we don't know the precise mechanisms. In fact, this coming Monday, the Institute of Medicine is having a meeting where all the experts on this type of virus, the filovirus, are getting together to help. But there's some things that we know from observation. We know that it's unlikely to get this by casual contact. That is to say, compared to measles or the flu, if I had measles and the flu and you hadn't, you would be at risk from sitting next to me and talking to me, because I would cough and spew it into the air. we have very good reason to believe that this requires a direct contact with the skin of the patient, and at a time when there are lots of viral particles on the skin, and live viral particles. So in the patients who are recovering, even though you can find it by molecular techniques, we know the virus isn't there. So the exact method of transmission we're learning as we go, because the experiments are dangerous to do and we haven't had them. But the observations are pretty clear, who gets sick and who doesn't get sick.
So a lot of these rules were put in by states, New Jersey, New York, about these quarantines, was done out of panic. And people are worried. They think, well, rather violate somebody's civil rights for a few days than chance putting them into the public arena and having them be contagious. I mean, did you think that was ludicrous, that quarantine tent that one woman was put in?
So at least they didn't put her in a rest area on the New Jersey Turnpike. That would have been worse. But I think it was an overreaction. We have to stay calm at this point. Take, for example, the people who are on the ground in Western Africa. Médecins Sans Frontières has had many Ebola treatment centers. People come there and work where they know there are people who are transmitting the disease, and they have very, very few cases. In fact, Dr. Craig Spencer is the first healthcare worker to develop Ebola out of country for Médecins Sans Frontières, with many hundreds of people who have done that. So we know this isn't all that contagious. And I think the actions taken by Governor Christie suggested that we were dealing with highly contagious. Now, it's clear that at a certain stage of the disease, a very small inoculum can lead to infection. But when the patient's at that stage of the disease, and that nurse that they trapped at the airport
really?
Wasn't at that stage of the disease. And Craig Spencer, the very responsible physician, when he began to be symptomatic, brought himself in, which was right what the Doctors Without Borders protocol said you needed to do. So there's, as far as we can tell, based on the information we have, which is not 100% reliable, but it's reliable enough for most people, is that they're not infectious and that we don't have to worry about it. And the data speak for themselves. Right? Otherwise, if this were really infectious, the emergency room doctors in Texas Presbyterian, the nurses who cared for that patient at the beginning of his hospitalization, they all would have gotten sick. The people who got sick were the nurses who cared for him at the end.
All right, like I said, I'm convinced. Dr. Jeffrey Drazen, thanks so much for joining us. All right, well, last night we asked what you think about mandatory quarantines, and most of you agreed the policy is out of line. John writes, where did Governor Cuomo and Christie go to med school? Another viewer says they're sounding the alarm because of the political season. If it was not close to the midterm elections, you would not hear a peep out of them. We also heard from Gary, who sees the sense in the policy, writing, we should challenge anyone who says the bravery of medical volunteers gives them the right to selfishly expose others to a disease with the fatality rate of Ebola. Thanks to everyone who weighed in.